Good evening. Since we've all introduced ourselves, and I've introduced myself, it gives me my great pleasure to actually talk to you a little bit about our speaker, Christine Ngaruiya. She's a physician and researcher committed to fostering better health outcomes for underserved and minority populations in the United States, and particularly in relationship to the global crisis of non-communicable diseases, or NCDs. I had the great pleasure of knowing Christine since we met at a conference in Kigali in 2019, I believe it was, when it was a Women Lift Health conference. And this past fall, she actually joined the Department of Emergency Medicine with the following title. She's Associate Professor and the Population and Global Health Research Director. And in that role, she provides guidance and insight and leadership related to non-communicable diseases. Prior to Stanford, Christine, come on in. Christine actually was a member of the faculty of Yale for many years. And over the past decade, she's partnered with local institutions to raise the awareness of the burden of NCDs in settings that range as far as Nebraska, the US, to Kenya, and also to Pakistan. She was a senior collaborator on the first ever national study on NCDs in Kenya in a WHO validated survey coordinated by the Kenya Ministry of Health and a variety of local NCD stakeholders. She also researches community-based and technological innovations, including the use of mobile technology and AI in low-resource settings. She's a graduate of Women Lift Health, and she advocates in that role for really mainstreaming gender in the area of non-communicable diseases. She's also the founder of Kenya Doctors USA. This is a nonprofit that provides an opportunity for discourse amongst the diaspora physicians in the US. And also founded Yale Through the Eyes of She Gender Equity Initiative. Christine earned her medical degree from the University of Nebraska. I'm glad I see Zoe Hughes coming in. She earned her medical degree from the University of Nebraska Medical Center and her master's in tropical medicine and DTMH from the London School of Tropical Medicine and Hygiene. And she also served as the Global Health Fellow at Yale. So it's quite a long introduction, but she deserves every word of it. This is really a session that was requested by students to get to know our faculty better. And it will be run by a student named Zoe Hughes, who's over there. Raise your hand, Zoe. She's a medical student and leader of the Organization for Global Health. She'll be doing the Q&A tonight. I'm sorry, I have a conflict that I have to leave at 6. Zoe graduated from Harvard in 2020 with a bachelor's in neuroscience and from Duke University with a master's in global health. She's worked in South Africa, Kenya, Ghana, and Ethiopia, really interested in universal healthcare and how many of those countries are working to have national health financing to provide that healthcare. So I am going to ask Christine now to talk for a while, and then Zoe, I'm going to give you this to set up the Q&A. Okay. Christine.
All right. Thank you so much, Michelle, Professor Berry, for that very kind introduction. We actually met literally in an elevator, and where I gave her an actual elevator pitch, but we can talk about that soon. And it's really just been a lovely relationship since then. I have you later on in my slides, but you'll see the video. So anyway, it's an honor to be here with you guys. I was so excited to be able to be a part of this series, and I really hope this to be a discussion, including some of the questions towards the end. But when I was thinking about what to talk about today, knowing that this is a trainee-focused talk, I was thinking I'll present it from something I really care about a lot from that lens and talking about mentorship. Okay, so I'll be talking a lot about my story, some of which you've heard. There'll be more time for questions, but I really want to focus and hone in on some tips for mentorship, menteeship, and what that looks like. Before we do start though, I wanted to kind of get a sense of who else might be in the room. I know we had a lot of trainees coming, but there's a few other people and I don't know many of you. So just by show of hands, do we have any undergrads in the room? Oh, well. We went around. I think about starting early later on the pod, so good for you for being here. Medical students, several, residents, fellows, postdocs, faculty, postdoc, I didn't see. Faculty, they're mostly over here, yeah. And anyone else, staff, I know, it's gonna be awesome. We appreciate you. Anyone I missed? Does it fit in one of those categories? The public. The general public. Oh, great. I didn't know that. So we'll be a bit more specific about terms, but helpful to know. So thank you all for being here. So the outline for today, we'll start with a basic overview, just defining what mentorship is and what that looks like. I'll talk about my own journey, my quote composition as it were, and then I'll talk about menteeship, which again is something that I think is extremely important to also talk about that we don't have to do as often. And then we'll conclude and turn over to Zoe for some questioning and the rest of you. So just by way of mentorship, great mentorship, as hopefully many of you have experienced, can be really awesome, right? So it can be helpful, as many of us had in undergrad, in thinking about academic achievement and attaining a degree and what kind of degrees we want to pursue besides maybe medicine, MBAs, now we think about MPHs and so on. But it can also be very important, even as you get more senior, to think about career satisfaction and retention, okay? So the reality in medicine, like unfortunately you young budding minds are seeing, is burnout is real in our careers. So how are we thinking about supporting one another and having the right mentors or right people around us to help with retention, help with satisfaction, and also sometimes even psychosocial support, which may come from mentors and may come from some others. We'll talk about that too. The flip side to that, of course, is that if mentorship is done less effectively, of course, it can be, sorry, am I moving around too much? Okay. If done less effectively, mentorship can also be detrimental in some ways, right? So if mentors are absent or unavailable, I see some head nodding. Well, maybe they're not very effective at communicating what their goals or hopes are for the relationship. Worst case scenario, of course, is manipulation and someone taking credit for your work, which hopefully doesn't happen frequently to any or many of you. There might be just a lack of expertise despite someone's good intentions. And then finally at the bottom of the slide is I like to highlight the importance of the match, right? So you can have a really awesome mentor, really awesome mentee, but if the two of you are not like a good match for various reasons, that also may result in a less effective relationship. And again, we'll talk a little bit about menteeship towards the end. So just to be clear, and the same guideline on definitions, there are a number of people that can be in your network that are supporting you to get to your goals of being the best version of who you want to be. The four I chose to pick to define today were mentor, sponsor, coach, and therapist. All four of which I've had the benefit of taking part in, and all four of which I highly recommend at different stages in careers and goals depending on what some of your needs might be. Okay, so most easy one, we'll talk on that's the nature of the talk today, is a mentor. And good old Merriam-Webster tells us that is a trusted counselor or guide, right? What else? Some say we can describe it to Homer's Odysseus and Athena, who apparently was now in this case mentoring Telemachus, was telling him that he was more capable than he realized of managing some tasks while Odysseus was away from the home. And I really like this quote from this woman, Kevin, who published in NEJM this year. Is an interesting paper I read in preparing this talk that says, a mentor is someone who has more imagination about you than you have about yourself. And I really like that. And I really think that that is what a mentorship relationship should be like. And it's hopefully something that we're all aspiring to as mentors, and that hopefully you get to experience as mentees. All of us get to experience as mentees. On the counter to that, sponsor is a slightly different term. Offshoot of mentor can be mutually exclusive. So just out of curiosity, has anyone heard this term before, sponsor? Okay, good. I know a lot of faculty probably. Anyone Kenyan? Heard of the term sponsor? Not that kind of sponsor. Okay, never going to say joke about Kenyan in London. You can ask Kenyan. Yeah, you heard of this? Okay, you can ask somebody who's laughing a little bit. Not talking about that kind of sponsor. Talking about sponsorship in academia. Okay, So as I said, can be mutually exclusive. You can have somebody who's a mentor that sponsors you. I'll call it Michelle. She's been a mentor and a sponsor to me. Very grateful to her for many things. You can have someone who's a mentor and a sponsor, but you can have a sponsor who's actually not a mentor, right? You can have someone completely separate, who doesn't meet with you regularly, is not necessarily even really active in maybe your day-to-day. Maybe you don't even talk to really at all, just very periodically around these sponsorship opportunities. So a sponsor is generally a senior person that publicly acknowledges and the achievements and advocates regularly for this mentee or sponsee. And it's someone who, by official definition, is assuming responsibility in some way for your wellness, your growth, your output. And so just to further build on that, this is somebody who does a lot of endorsement, opens up their networks, for better or worse, putting their necks in the line and opens up their networks to you in a unique way. And they provide strategic exposure and opportunities, throughout your career. So some examples of that. This could be someone who tweets out your work to their 20K following, right? Who maybe someone in this room has 20K following. I don't. But sponsorship can also work from a mentee, right? But tweeting out your work to their 20K mentorship. Could be someone putting up for a position or a promotion, a leadership opportunity, someone who works at WHO saying, hey, I want you to join my committee or this consultancy. That's sponsorship. Someone going out of their usual or the usual steps of mentorship to really kind of lift you up into opportunities that you might not otherwise have a chance to be part of. I put this up as a reminder. Sponsorship, we say, is not usually something like mentorship that you can choose. It's this like hand wavy thing where the sponsor sees this light and says, I want to sponsor that person, which is like a little tricky, right? There's books on this and how, the inequities around gender and race and other things come into play around sponsorship, right? So, some of the solutions are, one, people who are, and many of you, I'm looking inside of the room, you get more opportunities. Think actively and very intentionally about who you sponsor, who you mentor, but also who you sponsor. And then in turn, as a potential sponsee, being very intentional about where you place yourself. That's the meme, right? There's all these jokes on the internet now about dating and how it's impossible to find people to date because we're all sitting at home waiting for someone to break into our homes and find us. Okay, so it's the same thing with sponsorship, right? So no one is going to know about this seed, this bright light in you, this potential you have. You're not putting yourself in positions to be discovered, to be as trite as that sounds, right? So going to conferences, going to talks like this, meeting with various potential mentors and sponsors, and it's really making yourself visible so people think of you for different opportunities. And hopefully, gracious sponsors do, put their necks out for you to continue to advance, which I'm sure many of you have or will, being here just by way of by virtue of being in Stanford, quite frankly. The last two definitions I wanted to go over were a coach, something I've also done. I would not go without a coach. I've had one for the past 5 years. I actually just added a second coach to my team, right? And so this is someone who is really thinking about getting you to being the best version that you possibly could be, who doesn't necessarily, by the way, have to be an expert in your field of work. So this is somebody who actually trains. They have their own boards that they do to lead people through different frameworks, approaches, styles on, say, getting really good at public speaking. Or maybe you want to think about your public presence, or perhaps you want to think about navigating challenging conversations or conflicts. You can actually hire someone called a coach who then can help you work through different parts of these aspects of your life, personal and career-based, yeah? And then finally, counseling and therapy, which can also be extremely helpful. And generally, this is, as many of us know, because we're medically related, are people who are thinking about some of the psychosocial, determinants that traumas, et cetera, that might have happened in one's life that, again, are maybe mitigating your best output. And so the juxtaposition of the two is usually to say that coaches are people who are thinking forward. They're giving you strategies of, okay, I had this conversation. These are the tips, suggestions I would give you to move forward with that conversation, to do it better next time. Whereas a therapist is maybe thinking about the traumas and some of the other things that might have happened in your past to hopefully heal and reframe some of those maladaptive tendencies to be able to move forward effectively. The last thing I want to talk about in establishing our mentorship overview is this conventional idea of how we tend to think about mentorship, which is really like in a dyad, right? This one-on-one with both having a role, mentor and mentee working together. Moving over into this thought of what's called a cloud of mentors, okay? And how many have heard of this term? Have heard of this term? Shell, sure. Anyone else have mentors? No? Okay. And so this is just an idea where rather than just having a one-on-one, and I've kind of explained some of this, you have a team of people who are working with, on, for you, right? And so I think it's almost selfish, just like having a best friend, that you just have one person who does everything for you, and they're responsible for your career advancement, and your wellness, and your, promotion. And, I have this other thing I'm struggling with my partner, like, and it's tough for that one person to do that for you. And quite frankly, no one person, has all those skill sets within them, right? So the way I like to think of it, if I ever met with one of you, is I usually walk potential mentees or trainees through like domains I think about for if you want to do global health, people you might want to have on your team. And so obvious one is, of course, by specialty. So if you're like, I really want to do ENT, I want to think about doing ENT in the global setting, global context, international context. Well, talking to someone who's done that is probably a good idea. You may not be able to find that, but getting as close to that person as possible would be great, right? Maybe it's a surgeon then in that case, just to kind of get the idea. If you're thinking about a particular route of training, right? Maybe you're thinking about doing an MD, PhD, or an MBA, okay, and you want to meet with me. Well, I don't have either of those things. I thought about doing an MD, PhD. Talk about that later, but I don't have that. So I would very, briskly refer you to someone who does have one of those things or has done one of those things. So otherwise, I'd be doing you a disservice by not allowing you to think about speaking with somebody else like that, right? So training is another dimension you might think about. This is getting a little bit nitty gritty, but you're here at this talk, so I'm sure you're thinking about some of this. What is the area of work that you want to focus on, right? So I do non-communicable disease work, right? Like Michelle said. Someone comes telling me that they want to do basic science research in HIV, might be like, may not be the best person for that aspect of mentorship. You need to go talk to someone else. Does Dr. LeBeau, maybe Michelle, who's like, does ID work, right? Because otherwise I will be doing you a disservice by not being able to maybe appropriately tell you about the networks you should be tapping into and so on, right? Again, this is even a little bit more nuanced, but methodologies, right? So if you want to be an MSci expert, right? So I do some implementation science, we have some others in the group who do. So talking to me about MSci is a great thing. If you want to go, like I said, and be an expert clinical trialist, that is not my pathway. So again, I'm not the right person to talk to. So thinking about, is there a methodology you really want to learn to be great in? Okay, so that's somebody else you might want to think about. And then other things like just personal values, like so alignment by race or ethnic background, alignment by religious or other cultural beliefs, right? So these are all very important pieces of what make you a successful clinician, scientist, global health person. And again, like I said, you may be able to find these grouped in a couple people, but it's very rare you'll find all of this in one person, and that's okay. So again, you have the slides after to go over this, but again, just in sum, thinking about mentorship as this collaborative process, a relationship between the two of you. The mentor has some work to do, mentee has some work to do, hopefully based in trust and hopefully effectively contributing to make you the best version of yourself. I'm going to talk about myself next. So, but before we go ahead, are there any quick questions? One burning question. Clear? Okay, sorry, I know we're a bit behind, so I'll keep going. So anyway, this is my story, my composition. I am somebody who does not like change, okay? I really don't like change at all. This slide does not look like that, but I always tell people, but the lesson from my story, as you'll find, is it is important to be open to change, right? And it's also important to realize that there's no like one way to do anything for sure. So anyway, I was born in the state of Nebraska. Sometimes I quiz people to ask, but you already heard that I was born there. So I was born in Nebraska, reverse immigrated with my family back to Kenya for undergrad, for primary and high school, and then came back to the US for undergrad and medical school at the University of Nebraska. And so this is actually my first introduction to really great mentorship. So these are two really awesome people who in my life that taught me the first tenets of what it meant to be a good mentor and to be a good research mentor. So on the left is Dr. Julie McQuillan. She's a sociologist, was the former chair of the department, and Dr. Wagner, who's a basic science oncology researcher, formerly at the medical center there. And so they taught me the first beginnings of the scientific method, like how do you ask a scientific question, which I came to realize later was something so valuable I hadn't thought of. And later on, I was able to actually publish my undergraduate thesis, which is extremely meaningful, courtesy of Dr. McCoy. You won't find a lot of mentors who let an undergrad publish like a senior paper, a senior author paper, but she did, right? And just a testament to her awesomeness. But also was the beginnings for me of knowing what the social determinants of health are, thinking about the sociology of health, and has really formulated the entirety of the basis of my work now 20-something years later. And similarly, with Kai, Dr. Wagner, he still has this really little picture of me holding a new mouse in his lab. Again, just a testament to an awesome person who treasured his mentees, right? And also taught me like what basic science looked like as an opportunity, which I decided was not quite the right fit for me, but again, just an awesome experience and an awesome mentor. A base, right? So not a bad thing because it's still part of my composition. But I also had experiences with some not so great mentors in undergrad. One particular one who, for lack of a better term, put me into some scut work. So I was responsible for preparing the medium for this organism they were working on. And let me tell you, I did that thing with my eyes closed right now. I can still smell it, 20 years later. And I didn't really take time to learn my story. Didn't really spend a lot of time on building up my career. Got a couple of posters on it from it, but it really also taught me how I didn't want to behave as a mentor, quite frankly. So that was part of the lesson from that experience. And just realizing again, this is my composition, not good or bad, but just experiences along the way to be grateful for. So the next step was figuring out what specialty I wanted to do. And so obviously I chose to do emergency medicine. And I saw my first example of that in this really awesome woman named Dr. Bott, who was, smart, kind, efficient, effective, able to lead the team as this woman, in the ED. And I just really saw a lot of myself in her and what I'd like to be as a physician. And what outlined some of that was also realizing what I didn't want to be, or what I didn't want to do, right? So I started off by telling you guys earlier. So I actually thought I wanted to do MD, PhD, hemo, like that was it. And I thought about that as a process. I actually shadowed a bunch of hemonc, like a couple MD, PhDs. In the end, one of the MD, PhDs was a little sour, so probably shouldn't talk to him, but it all worked out. It was like, if you don't really want to just run your own lab, then the MD, PhD may not be the best fit for you. You can still do research as an MD, and all the PhDs firms that follow. But you still can do research as an MD, right? It's still a possibility. So, okay, well, maybe I don't have to do the MD, PhD in 7 years. Watch my, the peers graduate, all these things. That went lower on the list. I also thought about doing MPs, and I was like, I am not a morning person. Like when I think about waking up before 10 a.m., I want to pluck my eyeballs out. And I was like, I cannot do 3 years of residency, 2 years of fellowship, and then God knows how long as an attending, get to sleep in as an attending, but God knows how many years as an attending, waking up at 6 or 7 in the morning. I was like, that is not the life for me. That is you, wonderful. And then the last bit was, with EM at that time, one of the factors was I knew that it was very possible to create a very flexible schedule. Because it's shift work, so you're able to bunch your shifts together. I can leave and go to Kenya or Africa for 2 weeks at a time with little harm. It's much, much better these days. I like to advise mentees, right? Now we have hospitalists, we have ophthalmologists, and really surgeons, because global health has really pervaded a lot of different departments and specialties. People realize the importance of it, and they're ensuring that their trainees have and their faculty have an opportunity to engage. So much less of an issue now. Shift work still can lend itself to that. Anesthesia, hospitalist, medicine, EM, stuff, some surgical specialties, but it's much more possible. Okay. So I did EM as a result, went into a 3-year program at UNC Chapel Hill, really loved the opportunity there, working with one of the founders of our specialty who wrote our textbook. Her name is Judith Tintinelli, and she was actually the founding chair for that department, and working with another really awesome person, Dr. Ian Martin, who was my associate program director. And then I think I started to understand the importance of women in medicine and leadership. So you had this awesome, giant of a person in our specialty, and getting to realize, the importance of that. And ever since then, I've actually only worked in departments that had female chairs. I highly recommend it. Nothing wrong with male chairs, but I highly recommend it. So, and also realizing the importance of alignment, even in race and ethnic background, working with Dr. Martin, who was a mentor, sponsor, and continues to be a close friend even till today. And so lastly, towards the end of my journey, I moved to Yale, where I stayed for 10 years. And so I did what's called a global health fellowship. So if you do emergency medicine, there are these 2-year programs, 1 or 2-year programs, where you get a master's. So mine was the London School of Hygiene. And you're building yourself up in an area. So for me, that was research in non-communicable diseases. And then you're working clinically as an attending in whatever facility you're at. So that's the nature of the fellowship. So I did mine, really great experience there. And that's why I really grew, like, I would say exponentially really as a researcher. So I think really awesome people, my second female chair, Dr. Gil D'Onofrio, really fantastic person in general. There's a reason I'm putting all these names up here, because if you're thinking of other mentors, I can confidently refer all of these people to you, by the way. So Dr. Gil D'Onofrio, fantastic woman, fantastic chair, fantastic researcher, like top NIH funded, maybe like across specialties. She's great. And Dr. Fred Vaca, similarly, Dr. Bernstein, and Dr. Mawafi. And again, they really helped me get to the place that I am right now with grants and writing and mentoring others as well in research. One of the bases of that, I think this is very important. As awesome as those mentors were, contributions probably of mentorship and menteeship, is that I hadn't really gotten that nudge, that training, that push to figure out how to write federal grants. Okay, so as some of you know, if you're studying in academia, how many of you know federal grants are like significant currency if you're studying in an academic field? Okay, I'll just tell you right now they are. So, and I hadn't learned that, and I'm not quite sure why it's someone didn't stick their neck out for me, or I didn't ask the right questions, but I really hadn't learned that, and I realized at some point that I was going to have to learn that myself. So I picked up and I went to do this writer's court coaching group that I found on my own, the double ANC, also highly recommended to people in the room. And I also applied and got selectively, competitively selected for this training institute at the NIH on implementation science. And like those 2 things were transformational, man. Like I learned the back end of how to write a grant, invited by NIH to do some reviews, was top 100 for the past 2 years in my specialty in federal funding. And like, and it's so great that I got there eventually, but I am very mindful in like, why did it take me so long, and how can we prevent people like me from getting to that point in the future? So this is my one pitch to the people on my left side of the room. and a note to the on the right side. There's something called diversity supplements that NIH gives to NIH funded researchers. How many of you heard of diversity supplements before? Good. Okay. You should know about these as a mentor-mentee. It gives you an opportunity to bring someone into your lab or onto your grant. That could be an undergrad, med student, resident, and even junior faculty member that has some domain of diversity as part of their being, right? And so the other reason I put this up is for the mentees and trainees. I just had a conversation with one of your colleagues to speak about this. I always tell you, if you want to get into research, this is so great to have on your CV. This is so great to have an experience trying to write for yourself. Approaching a mentor who might have an NIH federal grant and saying, hey, I'd love to work with you on a project. Do you think I'd be eligible for a diversity supplement on one of your projects? And do you have something that I could work on? And if that's the case, I'd like to do the work to write that, okay? And I'd love you to mentor me if you'd be so willing. So that is a unique opportunity that I didn't know about. A lot of some good number of NIH scientists don't know about either. I think the NIH could do a better job. But anyway, needless to say, there's multiple ways to skin a cat. That's one that I wish had been entered into my life a little earlier, and now you know what it is. So then, of course, I ended up here with all of you. And I'm looking forward to building out my team and mentorship and sponsorship here as well. So last 2 slides, just a little bit on my own research, because I know that's also a question of interest. So I initially started working on health equity and underserved populations in the US. And this is an example of that I mentioned before, working with Julia. And then I learned about CBPR, community engaged or community-based research, and did a couple projects looking at refugees in the US. And I've also done some work on homeless, housing insecure populations in the emergency department. But I also knew the entire time that I really wanted to go back home. So I'm Kenyan, Memphis Kenyan, grew up there, as you saw. And I always knew I wanted to work on non-communicable diseases because of the health equity pieces around it, social justice issues around it. And so that's what I did. And have worked in NCD risk factors like tobacco and alcohol. Some of my work is, of course, looking in the emergency department, which has very high risk populations like mental health. And then other pieces of the work, like you heard from Michelle, has also migrated into digital health, right? So what kind of mobile health technology tools can we use? AI, NLP, like what tools can we use to improve care, both in the ED, but in the community to help reduce the impact of non-communicable diseases in Kenya and Africa. So that's a quick whirlwind of some of my work, but I feel like you can read about that. So I spend a lot of time on that. So again, my composition, right? There's more people than I can probably list, but I also put this slide up to say, like, thank your mentors, okay? Thank your sponsors. It takes a lot of effort, time, energy, heart, if they're hopefully doing it well, right? And so I thank them frequently, very, very frequently. Michelle, like I said, has also been one of those people who has been like really great for the past 3 or 4 years, and was definitely a push for me coming here. And at the bottom, I like to highlight, those are peer mentors, people that I worked with because I do non-communicable diseases, and not a lot of people in EM do that. So I work with a lot of internal medicine people, anthropologists, sociologists, and so on in my work. So again, hopefully you're working to build your composition with time actively and effectively. And so with that, we're going to talk briefly about menteeship, and we can transition to some questions. So menteeship. It's inherent in the word, so you probably figured out what I mean, but this is my own definition. Sorry, but it is the process of being an active participant in a mentoring relationship, including being clear about needs and goals, reliable, responsible, and following through. Now that sounds like a lot, right? Does that feel like a lot? Okay, well, being a good mentee, it's a lot. You know, if you want, and it's not so much what it does for the mentor, it's what it does for you, right? So the more effective and the more active you are in the relationship, the more you get out of it. So this is like my menteeship 101 best practices. If you're figuring out where to start or how to maybe improve, maybe some of these things can help. So the first step in being a good mentee or finding a good mentor or team of mentors is trying to figure out and really hone down on what your question is. So I can't tell you, fortunately or unfortunately, how many people have come up and just said, like, I'd like to talk with you. I'm like, that's wonderful, but what are we talking about? So that's nobody in this room, because I can see your side. So, but on a serious note, coming up with a very specific question, like I want to get into a residency X, or I want to work on research project B, or I'm thinking about developing a research team as a postdoc. Like come in with very specific questions. Right, so then this is sort of kind of tying into that. And then this doesn't necessarily need to be said, but also looking within yourself to see if you already have some of the answers to this question. I put this in italics because sometimes if you have another mentor, they can help you think about the question that you want to ask somebody else to add to your mentorship team. I do that a lot. Like I'll tell someone, I can't really, this is the ceiling of what I can help you with, but you should talk to so-and-so, Ian Martin, who can answer that. And here's the type of question you should ask them. I'm going to help you draft your email and send it out together. Okay. But I've also had on the counter to that, some people have come and talked to me and been like, man, like I've talked to 5 different people about this. And I'm like, okay, that's wonderful. You don't need me anymore. Like go sit with yourself, create your little spreadsheet of your priorities that I cannot tell you, right? And in a nice way, right? But you have to within yourself. So be with self. And sometimes people also need that nudge, just be like, you're okay. You've got the saturation of information you need. But another question. And then I also say, think about who the different potentials are for that list of people you should be talking to. Depending on the type of question, you might need to talk to a dean, a professor, a scientist, a residency program director. But try to create a short list of who should go on the potential list of people to talk to. And there are different ways to find these people. Google is a very practical way to look for people. I always encourage people looking at department and university websites. How many of you are like familiar? Is that ringing a bell? Yeah, you're in an academic institution. Departments and university websites often have all their faculty, often what they're doing, sometimes their emails. So that's another great place to look. Social media is our friend. Sometimes not, but it's still very useful for searching, doing quick searches on what people are working on and what they're doing. And then there's a couple that a lot of people don't know as well. ResearchGate, sort of ResearchGate. Okay, I really like ResearchGate. You can find the articles these days, sometimes over PubMed, because I think their search terms are much more specific. So ResearchGate is sort of like this, is like Facebook for researchers. So people put up their name, ID, different projects they have, and you can search them, and their emails are usually on one of the papers. So I like ResearchGate a lot. And then the last one is NIH Reporter. Who's familiar with NIH Reporter? Hopefully, yeah, of course, guys, I know. NIH Reporter is a database of NIH-funded individuals across the world. Could be anywhere, not just the US. I think there's one for NSF, I'm not sure. But basically, if you have a topic area of interest and you're thinking of getting your diversity supplement, yeah, you want to get a diversity supplement. Who can I work with on that? You can go to NIH Reporter, search for a mentor on a topic anywhere across the world and reach out to them. And you can see what they published on it, what kind of grants they got, their story, etc. So that's another tool for you guys. And then drafting I highlight succinct email. Okay, this is not, again, not to be rude, but the likelihood of someone reading a 3-paragraph sort of intimidating email and engaging when they're going through 100 emails every morning, as opposed to a 3-liner or a 5-liner that's succinct, catchy, I would like to meet with you. It's like, calculate the odds. Like, we're also human. I know I've skimmed over emails that were a bit long. So think about, making the email succinct. But I also say on the counter that don't be afraid to send a reminder. Okay, don't take it personally if people don't respond. So it is okay to send someone an email reminder like in a week. Okay, because we're human, people get overwhelmed. If they still haven't gotten back to you in a week and you still want to get a hold of them, I say try sending another polite email as well, because again, depending on seasons, life, loss, whatever else, people can be just busy and it's nothing personal. And I also say, be gracious. Probably shouldn't have to be said, but for anyone watching, sending a passive aggressive email as follow-up is probably not a good idea. This has also happened, and just think about like my likelihood of wanting to respond to that person or help them. I mean, I think I still met with the person. I apologize, but like again, we're human. We have lives. We have lots of busy things that we're working on. So just being gracious goes a long way. The human element is a big factor in all of these points, as you can see. And then I also say this is very important, and this goes to, it's like one finger pointing out, 3 pointing back at me. Allow people to say no. Okay. So people may recuse themselves from mentoring you, writing a letter, adding you to a project for a number of reasons, whether or not they tell you or not. But that's okay. Like, right? You'd rather probably, for all the reasons they're thinking of, not working with you, just recuse yourself from that relationship. Because, oh, by the way, kind of sometimes forcing or twisting someone's arm may result in the negative outcome that you don't want. Okay. Had people sort of like volunteer tell me to write letters, which in a couple of situations I actually did. But like, I was like, I'm telling you no, because I can't write you a strong letter. Like, I'm being candid and open with you, right? And that's the right thing to do. Hopefully mentors are doing that. And I wrote the letter, but it wasn't as strong as it could have been. If I asked somebody else, I'd suggest it to them, for example. So anyway, just, allowing people to say no and being, realizing that it may actually be better for you. Okay. And then go back to number 5, research more people, having success, and go down the list. All right. The very last thing, this is a nugget that I'll take lunches for, dinners for later. I can give you my email, phone number, just kidding. If you're not sure where to start and you're just like, this person's awesome, I think that they could be really great for me, and I'm not sure why I would have this gestalt. People love talking about themselves in general, like we all love others. So if there's someone that you're like, I just want to meet and kind of see and gauge if there's a way for us to work together, like asking to meet for 20, 30 minutes and saying, I just really love to hear your story, right? And then it gives you an opportunity also to be like, wow, this person's story doesn't include kids. I want kids, so this is not a good fit. Or this person's story is like not what I thought it was going to be. Or they're kind of rude in their directions. Or whatever else you pick up on in this few minutes of their storytelling, right? Is a good way to start, okay? So rather than I just want to talk to you, I would love to hear your story. Much better. Okay, so again, that's my composition, but we also need you, so please be, we need you to be the next generation that's doing awesome and great things, you've already started doing, but that will hopefully be aided by effective mentors and people in your network to get you there, so make sure you're also doing that. And so just in conclusion, I'd like to encourage us all to think about more than just having a single dyad mentorship relationship, thinking about a cloud of mentors, maybe coaching, maybe therapy, and I hopefully many sponsors to get us where we need to be. Remember that it's all a competition. Everything is coming together for your good in the long run. It's a long game, and that's okay. So some negative experiences are also okay. And then also remember the role that we play as mentees, right? Being effective in that relationship as well. And with that, I'm happy to stop and take any questions.
Practice. So we actually have a range of pre-prepared questions, like some are about like non-communicable diseases, and there are others about like your emergency medicine training. So I'm going to start with an EM question. So I know you talked about shift work being conducive to working abroad. That's something I thought about myself as somebody who wants to practice global health as a physician. But are there other ways you manage the dual demands, like practicing clinically here and also like working in Kenya?
Yeah, that's a great question. Thank you, Zoe. So I think one of the things is also just thinking about early on what your priorities are with your career. And that's as far as delineating what you hope to accomplish in global health, whether that may be clinical research or education, and also realizing the extent of how you'll contribute to international partners in terms of across those three or other spectrums, right? So for example, in my case, I was very clear that I contribute to Kenya and Africa in terms of research capacity building. They do help with some education. I don't help as much with clinical because I think that that is the less effective use of my time to go and train myself. There are tons of Kenyan physicians, for example, who don't have jobs. And so I've really been particular about our contributions to education, but research capacity is a gap, and that's what I really focus on. That's one thing when you cross that domain. And protecting your time and energy and making sure you're effective at least one thing. The other thing was what's the other part of the question in terms of being effective with your time and so on.
Yeah, and just managing like I know you said like shift work and it's flexible.
Yeah.
You can like take the time that you're not working and travel perhaps to Kenya or just pursue other research. But are there other like ways in which you balance the demands?
Sure. Yeah, and then I'm also just more broadly just very clear about my priorities, which for me are research capacity building, gender equity, and non-communicable diseases, of course. And so, like, if someone reaches out to me and says, "Hey, let's start this," not AI, it's a good example, genetics lab in Kenya, which I could probably contribute like some limited amount to. I am also very careful about my boundaries on like I'm not the right person, but let's think together of other people who would be able to help with that. So I think boundaries is another really important piece. What are your priorities when creating boundaries around this? And then the other piece is, for sure the shift work does help. So, but like I said, again, I think talking to different specialties, different types of people in the practice that you're thinking of doing is very helpful. So like I said, I know people that are hospitalists now, ophthalmologists who are doing really well with stuff, hem-onc, people who have like clinical trials going on in like Kenya, Malawi. So it's really just, I think, talking to some of the specialties to figure out how they do it. But the shift workers in particular are usually, EM, anesthesia, OB-GYN somewhat, and what's the what we usually say? Hospitals medicine. We're able to really just be like, I'm gonna group my shifts and then I'm gonna sell. Like, and nobody can, I don't have a pager, no one's gonna text or call me, I don't have to worry about my lovely, battery of patients that I really care about. And it's not to say that one shouldn't do that, because you should do whatever you want to do in clinical medicine, but it is something to just consider.
That was a really well-rounded answer. So I also, you talked about like building research capacity in other countries. I know like you yourself obviously have multiple publications. So what does it like look like building research capacities in other countries or helping that effort?
So, so you can talk to Dr. Woodward after if you get a minute. But so yeah, but yeah, like it's across the spectrum. Like it is official, as I have done, doing research workshops. I've been invited by like 3 different organizations across Africa to lead true like research workshops where bringing people together. And there's hundreds of attendees. Some I have mentored afterwards. Some we've had partnerships together afterwards, and so on. To working alongside institutions and a group of individuals at an institution. So like I work closely, for example, with the Ministry of Health in Kenya, and we really sit down whenever we have a potential idea together. And I really turn the question back over to them to say, I know I'm a strong grant writer, that is a fact. But what do you want to focus on as part of this potential grant idea or something else that we can do? And and then they tell me or they share, and we think about the nitty-gritty together, meeting regularly and so on. So a lot of our projects, we also I also try to encourage, I guess, I said CDPR, good and community partners, and as part of implementing our different projects later on as we get funding or get opportunities. And so yeah, I would say I think it's really feeling yourself as for what's needed, and really asking your partner in the national context, in my case, like what they think would be the best for them. As simple as that sounds. So
That's a really interesting response because my med scholars summer research was interviewing national policymakers in the African Ministries of Health Offices.
yeah.
And like, because I think that there is always an abundance of research funding in like the US and other global north countries. But there's like high research, like a demand for research to be carried out in the global south countries. I mean, as there is everywhere. So it seems like you're really a bridge beyond also just like building capacity in these countries, you're also a bridge in connecting like people to funding. Yeah, and just supporting them, conducting their own research, essentially.
I guess I'd add two more things for as you're talking is I'm very active in also individual like one-on-one mentorship. So I spend a lot of time with like probably an average of like 10 mentees at any given time working on different projects, ideas, their careers, etc. So there's that bit to it who hopefully come along the way as part of the project. We have for I think for residents to change or no, it's post residency, right? So we also have this fellowship, fellowship called Global Health Equity Scholars. It's Stanford, Yale, Arizona, and one other school, and we actually send trainees from yeah.
Yeah.
Do you want to talk about it briefly?
Oh, yeah.
GHS?
Yeah. So basically, it's a research fellowship through sponsored by the NIH we're in a consortium, and it's an opportunity to spend like 10 to 11 months at one of the sites that's part of this consortium doing research with the local partners there. That's one part of it, and then the other part of it is that the researchers from those different institutions have an opportunity to work with the Stanford mentor, like they always do, but are able to come here for a few months as well. So it's kind of both to those countries and the LMIC folks.
Right. So for some of you that might be into this interest, so I'm like the GHS mentor. I was at Yale and I transferred over to here, so I have 3 or 4 and maybe time on that as well. There's one other thought I had. Oh, I don't have one of these. I think Des does. It's called D43. I aspired towards one, which is an NIH training grant where you can then contribute to. Well, I'm a mentor on a couple of them, but I'm not. I don't have my own, but it's where you write a training grant where you're training a body of scientists, usually in the international context, on a given area of research, for example. So I said I'm a mentor on a few of those, but as many of you go on in your careers, think about writing D43 and fill capacity potentially as needed. So yeah, those are some of the ways that are potential.
I don't have one, but we should write one together.
Oh, yeah.
Beautiful, non-communicable pieces.
Yeah. I know there is.
Okay. Sorry, I'm really bad at like I'm listening to you and then I was like questions.
Okay.
Somebody says I'll ask some questions about chronic diseases. So somebody asked, what do you see as the most promising approach to treating chronic diseases in low and middle income countries?
Yeah, so I really think prevention is going to be key. I mean, many of us think prevention is going to be key. There's some secondary and tertiary prevention when people already have the disease, but those tend to be very costly. It's much more easier to prevent someone's kidney disease before it happens than to try to provide dialysis and some of those contexts. And the health, the poverty drive that occurs with managing chronic diseases in a lot of those settings is also very impactful. And so prevention is key. So I have done more work recently on risk factors, like I said, tobacco, alcohol, like in kids, the substance use, and with this other grant we have through the Gates Foundation, looking at using ChatGPT and BARD as educational tools for NCD risk factors for youth as well. So that's one thing I would say. But like education is going to be key through and through, whether someone is primary prevention or disease management. One other thought I had that escaped me as you're talking, but yeah, definitely prevention is key. We think about the big 4 for the effective education. We talk about NCDs in the global setting. We think about cardiovascular disease, diabetes, cancer, and chronic respiratory diseases. And so the WHO, SDGs, and everybody else have really put their time, money, resources, targets around those big 4 And then as far as big risk factors that contribute to like 75–80% of deaths globally. And if we think about risk factors, it's diet, exercise, tobacco, and alcohol. Tobacco being the leading one. Like if we could knock out tobacco, I think tobacco is actually lead risk factor killers, period, because it's across cancer, it versus TB outcomes, it versus so many things. So if we had to put our money on something, or if we had to work on project area, that's where the need, demand, and asks are. So yeah, that's.
So like I also was wanting to ask, which I feel like you answered the question I was wanting to ask, which was that you studied the social sciences of sociology, right? Yeah, as an undergrad, and you said that introduced you to social determinants of health. But then obviously, like in clinical practice, sometimes we can feel really constrained about how we can address the social determinants of health. But I feel like you just saying there, like your research looks a lot of the risk factors and also like the considerations on secondary and tertiary prevention. And honestly, like that is an approach that we should be using here as well. It's just the fact that it's like you said, it's very hard in some of the contexts you work in to deliver dialysis, but obviously it's easier in the US. So it's like easier to prioritize preventative approach. Sorry, I kind of stole the question.
Yeah.
But I mean, I guess I can still ask, given like your interest in social determinants of health, like how do you feel like you can address that in your clinical work?
Yeah, I mean, overall, I think you all are coming at such a great time. 10 or 20 years ago, we didn't have like social emergency medicine groups and like social internal medicine groups and like, surgeons for social justice, like those didn't exist. And I feel like now more and more, they're like quite pervasive. There are groups like that in undergrad and medical school. So I think it's actually very promising that we're starting to at least think of it. I think my big takeaway from that is are we just thinking intentionally, attending talks like this, of course, you are like sort of preaching to the choir because you're here, but in every step of your work, and clinical care, being mindful of that. And also, if you have the opportunity to contribute, whether it's an educational role, administrative role, when you go and be also leaders, or research, if that's going to be your interest, you're thinking about how you incorporate that into your work. Thankfully, there's increasing more mandates that make us think about social determinants of health and like from funding mechanisms, like NIH will ask to make sure that you have like gender-based type of like indicators in your grants. So it's sort of like a guardrail that we have to be thinking about like gender. And then, certain reviewers will ask, are thinking in this mindset as well, will ask this kind of things. What were your best Jewish determinants? Do you think about them not doing that in my segment? Control for them, etc. So I think we're on the right trajectory. More is more. So keep pushing, keep doing what you're doing. As trainees and mentees joining groups that are doing these kinds of things, learning about ways to get involved. I didn't really have slides on that, but there's lots of ways to get involved. Yeah.
Oh, absolutely. I'm done. So I was just gonna say, I was just gonna turn it over to the audience. So I don't know.
So thank you so much for being here. This is the first time I saw therapy listed in the coach sponsor mentee, and I wondered one, why you chose to put that there, and two, how working in global health, like what lessons from therapy were specifically needed to like unlock your trajectory in global health.
Yeah, I mean, for one, I think I'm very much on stigma. I think we should talk about it more, especially in our field. So I don't think anything to be ashamed of. I think it shouldn't be strange to like give talks or talk about it. Yeah, I mean, I think I personally think all Africans should go to therapy. I think that's very wrongly. I think our parents and ancestors did the best they could, but man, there's a lot of trauma, like a lot of trauma there. And so I think it's unlocking, for me at least, unlocking my own potential and sort of being able to let go of certain things and all about dependencies, and whether it's like relationships or trust and this kind of thing. I think it's going to be a better person. Yeah. So yeah, but I mean, I think if one is not sure, the best way to go about it is probably to consider meeting with one for whatever it's worth. Usually when you meet with a therapist, just like you do with a coach, you'll have like a one-on-one, and they'll tell you, hopefully if they're a good therapist, like, I don't think you need therapy, you need coaching. I don't think you need coaching, you need therapy. Or you need to go journal. The answers are in you. Okay, well, yeah, no, I mean, they're definitely out there, that they're not just like money for free, which can be hard to tell, but, yeah, so, I believe they're kind of like closed amounts of time, and they're like, we'll just keep going on for like ever. It should be sort of like, even with a coach, same thing, establishing a relationship around 3 months or 6 months, is the typical time frame, to see you grow through an objective. Can I say it helped my work specifically? I mean, I'm really interested in mental health, and some of the important outcomes, got morbidity and global health. But, yeah, no, I think I should be a better person, better researcher. Good question.
Thank you for your talk. I'll introduce myself. I'm a clinical research coordinator and I work in oncology here at Stanford. I'm planning to, pursue graduate school. And I had a question about how you maintain your connections and your contacts across space and time. I kind of have a similar trajectory in that I've lived in several continents and I've had amazing mentors at different stages. But once you transition to another stage, perhaps that person's no longer as relevant. And out of courtesy, I want to, reach out to them, but I'm often stumped about how to do that. With interpersonal relationships, maybe around, a year, I'll send like a season's greetings message.
Yeah.
But when it comes to those more career-focused contacts, how do I reach out, especially if I don't have a question to say, but I do want to just signal that, I'm still here and I see you.
Yeah. Great, so that's perfect. So I think one thing which I love the way you framed it, which is like owning it, and I speak to myself about this too, because I mean that about it. It's not, if we do not get to a certain goal that we're hoping to get to, it's our goal, it's not the mentor's goal. So you've already said that, so I'm just restating it for menteeship promotion. Number two is periodic meetings. So it's very commonplace for people to say, hey, let's do quarterly check-ins. Monthly might be a bit much if there's not like an active project we'll be working on together. But I'd love to check in with you like quarterly just to see how things are going with my career, with my graduate goals, etc. So that's a given. Half an hour, as long as you had a good relationship, no one is really going to say no. And often you'll find something that was valuable to talk about. So what's going on right now? Well, I have these two things happen. I'm thinking graduate schools. I just finished my sports. I have this project running on any tips on these two things. Number two is I'm really big about like in terms of like the self-promotion box, I guess. But it's also a way to keep tabs with your former mentors and coaches or whoever else. Is sending out emails when you have really cool things that happen and seeing them. And I usually frame it like hello, awesome team or whatever I say, and like thought you'd like to know that I published this paper, and that and you can frame it in like that you should. I'd love to hear your thoughts on it, and also feel free to share it with anyone that you might see of value. See what you've done. You've done a little self-promotion. You might share your paper, and you're staying connected with them. They're doing awesome things you do, and then they'll need to sponsor you. Like, oh, I didn't know you were like doing all this cool research. I have like 3 papers this year, whatever it is. So hopefully those things are helpful. Yeah. And then like, whenever you're in the area, reach out to people. Again, mentors, and I'm sure you're also a mentor of our humans. We like to see people. I love it when a mentee is like, I'm in town, would you like to have coffee or dinner? And I'm like, absolutely. So yeah. Thank you.
So as a mentor, when somebody, years later comes back and wants to talk to you as a mentee, do you find it awkward by any way or no?
No. I took a benefit of the doubt. I mean, I'm sure I figure if somebody is like trying to reach out that they've probably gone through what, like, tell me again? Any of them? Any of us gone through like, we're probably afraid or concerned or you're more than the alternative, like they're, I don't know, bother me. Like that thought seemed like this was the guy. Yeah. Unless it was a very, 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 very low experience, which is like, that never happens. Like, so you know what I mean? Like, so no, absolutely not. Go for it. Yeah, go for it. I just love to reconnect. Can we spend 30 minutes? Me tell a little bit of what I'm working on. Anything you have going on? I suggest you do this, and that. Yeah, go for it.
I was just getting a question. Is this will be our last question? Yeah. Okay.
It's about what skills can we be building right now as like medical students and medical trainees to support us being able to carry out global health work in the future when we're fully fledged clinicians.
Yeah, that's great. So a couple of things are, I think this is a lot of this is gonna happen through mentorship at this stage, unless you're someone who came to grad to school with a master's or PhD, which some people have. And so it's kind of learning by osmosis and watching how other people work. And I say do that by getting as close to whatever it is you want to do in your life as possible. Like, I feel very strongly, like, if you want to work on basic science in Nigeria, don't go work with an epidemiologist who works in Thailand. Like, once you got to graduate school, I feel like that's rough. You did an undergrad, it was a necessary, evil. It was a necessary thing we had to go through. Picked up some other skill set, scientific question, very basic things. But now you should be kind of getting as close to your asymptote as it were. So, and through that, you'll gain, research skills. So like how to apply epidemiological methods, how to design a research study, how to do some basic statistics. So those are some of the skills that you'll start to build, how to lead a team, how to write a paper, hopefully how to submit an abstract, how to do a presentation at a conference. And so really those things I'm listing are the kind of things that you're starting to think about. Sometimes I'll say it's helpful to like do some short courses potentially. If you're really, really interested, if you have time. It's very hard in medical school, so I don't always encourage it. The mentorship usually will give you enough of sort of what you need as you're kind of going along the way. But if you really think, like I really love the epidemiology, there are great courses on Coursera. Short courses, well taught, well reviewed. Will Google, or you want to learn how to very basically do some R or like Python coding. Like there are great courses now that are free online. It doesn't hurt. I wouldn't go crazy, but like if there's 1 or 2 things that you're like, or a research methods course, pick one of those and pursue that. It's also starting to think right now, hopefully also through mentors, about courses that would be helpful to you. Like, are you thinking about NPH? When is the right thing to do that? Are you thinking about MSc? When is the right thing to do that? Thinking about a PhD, MBA, health and economics degree. And then, I mean, this is like the team's answer, which is like, just be the best at what you can, which is being a really good clinician at this point, because you can like go off and be like really great at stats. But if you're working in a department and like you're unable to see patients, that's gonna be a problem. Like your chair is gonna have a problem. So be really good at doing medical school or school now and learn to be a really good clinician resident. And like they'll be able to do get a master's or population science.
Thank you. Final round of applause.